pregnant in the house and you are seeing something that looks like your flow, or you are seeing your flow, this video is for you. I'll be telling you one of the things that can make you to see something that resembles your flow in your pregnancy and how it can be taken care of. There is one argument that goes on between pregnant women and healthcare professionals, whether it is possible for a pregnant woman to see her period. And with the two sides, a lot of people have different answers to give. For pregnant women, there are some people who can be seeing things that resemble their flow even all through their pregnancy. Sometimes they might be getting it at the exact time they are expecting their flow. For healthcare professionals, it is a capital no, because we have a clear definition of what your period is. Your period is defined as the shedding of the lining of your womb, which can never happen when you are pregnant. But this shouldn't take our minds off of what is important. What is important here, whether you are pregnant, whether you're a healthcare professional, is once someone is pregnant and she's seeing flow, it is something to go to the hospital about to find out what the reason is. Don't stay in the house and say, I'm fine, no, it happened to my friend, it happened to a sister, then I'm not going to the hospital. Please do not do that if you are pregnant right now. So let's continue to one of the reasons why you can see what resembles your flow in your pregnancy. It is called subchorionic hemorrhage. I'm going to try to explain it in a way you would understand. Now, your pregnancy sac is attached to the wall of your womb. If anything happens and that sac tries to detach, tries to pull away from the wall of the womb, it will leave something that looks like bruise there. Now, this area that looks like bruise would contain flow inside. For some of you, you are going to be noticing it as flow coming out. For some of you, you are not going to notice it at all. And for some people, it gets reabsorbed into their body. Some people don't even get to know they have it until they go for a scan. Now, when you notice flow at all in your pregnancy, the first place you should go is to the hospital, not to your friend who has been pregnant before, to go and ask her, did you notice this? What happened to you? In most cases, if it is somebody who has experienced this before, she will tell you, oh, it happened to me, oh, and nothing happened to my baby. In your own case, it could be a sign that something is going wrong. Subchorionic hemorrhage on its own can resolve without a problem and baby can grow without any issues. But there is something that is really important you need to know about this subchorionic hemorrhage. Sometimes this detachment can be very bad. What do I mean? It can detach until that pregnancy detaches completely and lead to a miscarriage. That is why you should go to the hospital early. When they find this detachment on scan, then your doctor will swing into action. When you go for a scan, one of the things that the person doing your scan would look out for is the position of the subchorionic hemorrhage and the size of it. Depending on the position and the size, your sonographer can actually write in your results what they think. For example, you can see things like threatened miscarriage. When you hear the word threatened miscarriage, one of the things that your sonographer has seen on scan could be the subchorionic hemorrhage. If the detachment is little, in most cases, it will resolve on its own. You wouldn't need any assistance, and at the end of the day, you will carry your pregnancy, baby will be fine. But if this detachment is much bigger than the pregnancy sac, then it is something to look deeply into. In some cases, your doctor will ask you to go home and have bed rest. In some cases, they could give you some medications that could help cushion the pregnancy, that could help the pregnancy to stay so that you will not have a pregnancy loss. Have you seen that as little as going to the hospital because you saw flow can actually help you to save your pregnancy? What am I saying in essence? If you're in the house and you have seen flow, whether no matter how little it is, please go to the hospital and talk to a doctor about it, because it can save your pregnancy. In my next videos, I would also be telling you some other things that can make you to see things that resembles your flow in your pregnancy. And remember, whether you call it flow or not, please, it is not normal. Go to the hospital and find out why. If you are yet to click that subscribe button, this is the right time for you to do it. I will see you guys again in my next video. I'm still your Wongo Nation president, your celebrity sonographer.